My name is Jeanne Scheele. I'm a physical therapist here, and I've been practicing over 40 years, not all of it here, but over 40 years, and about the last 16 years, I've devoted a lot of my continuing education to just women's health and particularly pelvic issues. So the Kaplan Center itself is a pain management center, as some of you might know, and within that pain management, I see a lot of women who also have pelvic pain. Maybe there's an orthopedic pain as well, but neck pain, back pain, or just all kinds of pain anywhere in the body that the Dr. Kaplan, Dr. Lisa Lilienfeld, Dr. Erica LeBaron, and Dr. David Wang and Dr. John Broussard are our medical staff, and they would address any and all of those issues. But more and more physical therapists are getting into looking at this particular issue, and I'm thinking it's about time. And because who knows muscles better than a physical therapist? I'm so glad that there are more and more people interested in just devoting their time to the pelvis. And there's, the organs, the muscles, the ligaments, it's a very complicated area. But we're going to talk about some of that. So, aging, let me say getting older. Many years ago, my father used to say, Jeannie, just don't get old. And I'd say, right, Dad. I plan on getting older, and I plan on hopefully doing it very, very well. But what my dad was talking about was the journey of just getting older, the journey of, oh my gosh, you wake up one day and your shoulder hurts. Where'd that happen? And my favorite is, I think I slept funny on it, Or you wake up and now you're walking and you walk every day, then all of a sudden your hip hurts. Or maybe the ankle doesn't feel steady when you come down the steps. Or you notice you're a little off balance. I could go on with so many of these things. But what we're going to talk about today is coughing, sneezing. Oh my gosh, how'd that happen? I feel this tiny little release, and it stops you in your tracks. You think, how did that happen? What's going on with that? And that's the kind of thing I want to talk about, because it doesn't have to be. And I don't like it when your doctor or any doctor says, what do you expect? You're getting older. That's the kind of thing our mothers said or our mothers believed. And it just doesn't have to be. I have women that are close to 80 and they're still working with me, and they're doing well with learning how to control their bladder and what muscles to use to help with that. So we're going to talk about a number of things today relating to the bladder and some bowel health as well. So there are many components there's many reasons that contribute to why all of a sudden we have some bladder problems. Maybe there were previous surgeries, maybe you fractured your tailbone, or hormonally we change. And I think we've all heard that from our doctors, or we've read that in so many books, and it is true that hormonally we deplete in estrogen as we get older. Estrogen is essential for the muscles that we're going to be talking about. It's essential for our organ health. And as it gets more and more depleted, then you don't have the nice, solid integrity of the tissues that you had when you were 25, 30 years old. So hormonally, with the getting older, there's changes, and it goes along with our lifestyle. Our lifestyle can change too as we get older, in terms of being maybe more and more behind the computer, maybe driving, or just wanting to sit and crochet or read. A lot of us are avid readers, and then getting up and moving would be not on our plate that day to do. And you settle into a comfort zone, each day. And then as something aches or something hurts, then you're less likely to go out and and run or walk or do the treadmill or anything like that. So it's a cumulative effect because of everything we've been experiencing in our lives. It's cumulative that all of a sudden we start leaking. Some people will say, I've had this bladder frequency or urgency since a teenager. And that may be true. It can have happened a long, long time ago. So we'll talk about that. First thing I want to just go review with you is some more having to do with the bladder anatomy. On the inside of your manual, you're going to have a picture, just a basic picture of kidneys, ureter, bladder, urethra. It's on the second page. The kidneys remove all the waste products that we take in and from the bloodstream. Big job. And if we don't drink enough water, that process slows down. Okay, so we will talk more about how much water we need to drink, but the kidneys flush everything out. That goes into the ureters, which is the long tubes that are connected directly to the bladder. And then the bladder is your storage organ. It's a hollow organ, but it's also muscular around the bladder. And that's where the urine is stored after it's been filtered. Then it goes down to the urethra, which is about an inch or an inch and a half in females. It's a lot longer in males, but for females, it's about an inch and a half, directly behind your pubic bone. And then you have a sphincter control at that urethra, which will, an internal sphincter and an external sphincter, and it just has to let it all out or not, or hold it. And so the interesting fact is, and this number varies from depending on who's talking about it, but by the time you take that drink of water to the time it actually gets to you voiding, it could be an hour before that particular cup of tea or drink or anything that you can get. By the time it filters through everything, it could take 40 minutes to an hour to actually get to be voided. So the people who say, I just drank whatever and I have to go right away, you know, there's problems, and that can have started early in life too. But we'll talk about that as frequency and urgency. There are, talking about the bladder itself, it's the strong connection to the nervous system, connecting to your mind about when to empty, when to store. It's called a micturition loop. But what that means is that your pelvic floor muscles, which is what we're going to be concentrating on a lot, have to know when to actually hold back and when to release. And that just depends on the tissue integrity, actually. According to a lot of research, the bladder takes about 4 hours to fill. So the rule of thumb is that if you're going more frequently than every 3 hours, then you're not allowing the bladder to fill as much as you should. This is my little balloon, but the bladder should hold about 16 ounces. This is close to that. So this is an example of how full it should be. And when we don't allow that to happen, so now I'm talking about frequency and urgency, which is one of the problems with our bladders. When we don't allow that to happen and we start going just in case, or we see a sign on the restroom that triggers within us, oh, I better go. A lot of us are afraid of leaking, so we just don't want the bladder to get full for fear that we'll be in a situation where it might leak. But what's happening here is in the bladder itself, I'm going to say you have little sensors within this detrusor muscle, the bladder muscle. Then when you remember the kidneys and the urethra, they're filling all the time. You're not ever really empty, because you're filling all the time from all the fluids in your body to even everything you drink. Your bladder's filling. So there's always something in there. But what happens is that, according to a good normal bladder, you should be able to fill about 10 ounces full before you get the signal, uh-oh, I think I need to go, I better find a bathroom. So, but when we start emptying more frequently and not allowing that, those sensors are essentially reset. You know, you lower the threshold. And so when you might fill about 4 ounces, the sensors go bing, bing, bing to the brain, I gotta go. And then it becomes a habit. It becomes something that we are thinking about all the time, and it becomes a behavioral thing that we have to go to the bathroom and take care of that at the time. So there is a way to work with that frequency, and we need to, that's what we're going to talk about as well. The frequency urgency issue that happens with the bladder is both physiologically and psychological component. Physiologically, it's like resetting the sensors by your behavior. I mean, that's psychologically. Physiologically, we know the bladder is connected to the autonomic nervous system. So anything in your life where the autonomic nervous system, you know, that's your flight or flight system. With the autonomic system, where if you've had surgeries or accidents, even auto accidents, or a lot of stress, maybe a lot of losses in your life, things that just happen over time that affect this nervous system, the bladder's affected as well. You know, it's just, the fraying, I was so scared, I wet myself. You were just so scared, affecting this whole system, that your bladder just totally gave out. So, and psychologically, then there is the seeing the sign, I gotta go. Hearing the water run, I gotta go. You start associating things in your environment with where I gotta go. I've gotta go. Have you seen the commercials on TV lately? Oh my God, I think there's one where these 3 women are over a map of a mall. It said, there's a restroom there, there's a restroom there, there's a restroom there. It's like, okay, we got this, we're all scoped out where we need restrooms. It's such a big thing in their lives. They plan their days around where the restrooms are. And I remember my father used to do the same thing when he had issues too. I'd go out and, come on, Dad, we're going out to go for a ride. Well, is there a McDonald's nearby? He didn't want the sausage biscuits. He just wanted to know where the restroom was. So we had to, you plan your lives around that. So it becomes a habit. It becomes a behavioral thing. So urgency and frequency are 2 components, but we will talk more about what we can do about that. So you don't have to, like I said, it takes about 40 minutes for the water or drink to actually get here. Some drinks, like coffees, caffeinated things, will go through a lot faster because they're stimulants. The bladder is so susceptible to irritants. I put in your handouts, there's a whole list of different irritants that could possibly be one of the culprits that make you want to go more frequently. And what you do is you look at that list of irritants and you pick something to say, oh, maybe something that you're eating or drinking a lot of, and then try eliminating that for just a week. Then you notice, am I going more frequently? I've seen this over and over and over again. I have women coming in drinking a lot of the Diet Cokes and, carbonated drinks. And once they stopped doing that, the bladder settled down and they found out they are not going as frequently as they used to. That was the irritant that's making the bladder going. You just can't, maybe when you were 23, you could drink all the Coke you wanted, but it's just different now. It's not the same. So foods can irritate, citric things, so you can look at that if frequency is an issue for you. And I'm going to say urgency as well. Urgency means you know you got to go, but you just don't quite make it to the bathroom. Maybe you leak not quite making it to the bathroom, or you just feel like that urgency is way too strong, than it should be. So that same category, it's the same sort of issues. Right in here, I will also talk about UTIs, urinary tract infections, because some women, especially maybe after they've had babies, can develop UTIs, and it can be a problem all your lives, and then we go on all kinds of antibiotics to help deal with that. But in urinary tract infections, it's just like the bacteria love to hang out in some of these mucosal linings. And you can have a UTI and don't even know it, because you may not be so symptomatic. But if you're finding that all of a sudden you are having a lot of urgency or frequency, even if you're not feeling a burning, stinging sort of component to that, think about that. If it's something that's not part of your whole routine or the way that you have been behaving, it could be a UTI. So then you check in with your GYN or your primary care and say, I've been going to the bathroom an awful lot, and it's not usual for me, and you might want to be checked out of that. It's just a simple test, no harm done. So on the other end of that spectrum is something called interstitial cystitis. Does anybody know what I'm talking about? That's when the bladder is just so irritated that it becomes a chronic problem. And there's our urologists and urogynecologists will treat that. And it's all about really just the bladder is painful. When you first begin to pass your urine, it hurts like crazy, and then it can feel better. But it's that initial passing. There's still, the books are out there about why does this happen to some women and some don't. It's just really unclear, but they're putting together the pieces of the puzzle more and more about that. Today my intent is to talk about urinary urgency and frequency and stress incontinence. There are other issues with the bladder as well, but it's a whole other lecture to get into those sort of things. But most commonly, we have this urgency, or we have frequency. We may have stress incontinence, which is cough, sneeze, and all of a sudden you have a little bit of a leak. Or you can have both. I've seen lots of women with both issues. And so that's I want to talk about that in a minute. On your quiz, on here, question number 1, the urinary incontinence is a normal part of the aging process. No. Your doctors will tell you, you're getting old, what do you expect? And this is what our mothers dealt with and our grandmothers, and they said nothing to anybody. They said nothing because it's embarrassing, and they thought this is what's supposed to happen as you get older. Not true. The average bladder holds 12 ounces of urine. Nope, it's more like 16, so that's a no. It's more like 16 ounces. It's considered normal to use the bathroom every 2 hours, and I'm going to say false. You want to go for 3, sometimes 4. And how many of us have been to an event and we've held our bladders like a long time, because you just don't want to use that Jiffy John, right? Because it's just awful. So I'd rather hold it in my bladder. So my daughter can go by 8 hours and says, I'm fine, Mom. And I thought, So here's the thing, and I'm the only grandmother that will do this. My daughter has 4 children, and when I call on the phone, ask them now how often they are moving their bowels. Grandma. So, and I'm finding out one of them is like, about once a week. I thought, what? As a mom, you don't ask your kids anymore once they're potty trained, right? So you just let them do their thing. And I remember growing up as a child that I did have a long issue with constipation. But I never said anything. I thought, this is normal. Nobody's ever told me otherwise. It wasn't normal. So as a grandmother, I'm always checking on the kids, and I have one granddaughter who goes to school, and she will not go to the bathroom because she's too busy. So what happens if you store and store and store and store, this gets bigger and bigger. And remember, it's a detrusor muscle. The muscle can get stretched. What happens when it gets stretched? It may not come quite back because of all these other influences going on, and our hormones have changed, and so it stays more on the stretch side. If you overstore the bladder, so that's why I check on my grandkids. And I made detrusor muscle, D-E-T-R-U-S-O-R, or E-R, detrusor muscle. So there's a muscle lining around here. So I made my granddaughter promise that she would use the school bathroom, so that she has to not get into a situation like this. You've all heard the word overactive bladder, and there's all kinds of, that's the ads on TV, right? You see all these drugs on television that can be for an overactive bladder. And so what these are anticholinergic medications to help the bladder not contract as much. And so, you might feel a little better. Maybe some of you here have been on some of these things, Ditropan and Detrol and Azo, and there's all kinds of things out there now, more than there used to be. There are more ways of doing that. But there's a boatload of side effects with those, a lot, from confusion to heart palpitations to slowing down the motility of your colon. We're going to talk about that. And so you all might remember the gymnast, Mary Lou Retton, many, many years ago. I was reading an article about her, and she had a terrific problem with frequency. Didn't say whether she was actually having leaking or incontinence, but she had a terrific problem with frequency. And so, because she was under a lot of stress, right? She had to win the gold. But then she went on this medication for a lot of years to help control the bladder wanting to contract. And then she just decided she didn't like the dry mouth anymore. She didn't like all the side effects that come with it, and she went off of it. And within no time at all, she was just back to her usual self. So the medications can mask it all for a while, and it may help get you out of a very uncomfortable time in your life. But there really is a technique, and there is a protocol for helping to restore the normalcy of your bladder and voiding. So, number 4, if you are incontinent and planning to have more children, you can't do anything to help your incontinence until you're finished having children. That's false as well. Having children, number of children, big babies, that really stretches the whole environment. And a lot of women afterwards will have incontinence, and they just don't know what to do about it. And the doctors aren't quite sure about what to tell them to do. Or they may say, go home and do your Kegels. So you go home, and what's that? We've all heard the word Kegels, named after Arnold Kegel, a gynecologist, many, many, many years ago. But it's been improved and refined since then, which I'm going to tell you about. Drinking less will help prevent urinary incontinence. That's what we think, but that's not true. It's false as well. We're going to talk about how much water you should be drinking. Women who have C-sections with every birth will not develop urine. That's false as well. C-section is a major invasion right where, that little scar right there above your whole pubic bone, get the baby out. It's just a big, huge disturbance in the pelvic arena of your, not to mention the pressure that you've had with the baby while the baby's maturing. Older adults, it's normal to get up twice during the night. False. Some people say, I get up 3 times. No, false, not false. Once, okay. But getting up during the night, you should be sleeping. You should be sleeping soundly. That's when your body heals at nighttime. That's your sleep mode for your organs. That's where a lot of mending takes place when you get into sleeping. And when you're sleeping, there's a hormone within us called the ADH, antidiuretic hormone, that calms things down so that you can sleep. A lot of us, if we're restless sleepers, will wake up, and all of a sudden, on just that slight awakening in your brain, might start to think about what you're going to make for dinner, or the list, or this or that, or a person. Then your bladder is awake and say, okay, I'm up, what's going on up here? And then your brain says, I will not get back to sleep unless I go. So you might as well go. And that's what we do. We get up and we go, come back, and then try to go back to sleep. But it's maybe, usually not so much that the bladder wakes you up, it's just other things on this autonomic nervous system that's contributing to the bladder. It's a sensitive organ. You're gonna feel like, oh, I gotta go. It's one of the first things you feel. Don't you feel that first thing in the morning when you get up? That's the first thing of all your organs. I gotta be emptied. And it does, because it's filling all night long, okay? So that's a no. Some types of beverages can cause urinary incontinence. That's true. Carbonated, caffeine, alcohol. And it's all about how much of it do you drink. And like the lady I told you about, but she was a CEO of some organization, and at the end of her day, she knew she drank about 6 Cokes. And that was her caffeine to keep her revved up, to keep her going, and until she started leaking. And then she stopped all that. It was hard, because you get into a routine of something you like. It was hard. But I said, no more of that. You're going to switch to just water, maybe lemon water, no carbonation. And within a month, she came back and she said, everything is so much better now. But it can affect us. It's an irritant to the bladder. Anything that's an irritant will cause it to want to contract. Then you're going to the bathroom more often. Going to the bathroom more often is a good way to prevent urinary accidents. False. We get to thinking of that. We think that that's true. If you keep emptying your bladder, there's nothing left to have an accident with, right? No, you're still filling all the time. And it has to do with the control of your sphincter, which is exactly what we're going to be talking about. Professional athletes don't have it. Well, they do. They do. Mary Lou Retton's one of them I know, but I'm sure there's tennis players and soccer players and young women as well that just have this issue. We think about, well, they should be in really good shape. They have a good, strong core, and that's good. But the pelvic floor muscles, which we will be talking about, I know this is a little far away from you, but see the red? It supports all your organs. This is really, really what I want to talk about today, is the condition of your pelvic floor. It's the bottom of your core. If some of you have ever done Pilates or workout, or you're a runner, this is the bottom part of your core. And if you work with a personal trainer, they don't talk about this. Because what happens is that these muscles should work when you're training your abs. They should come in and work when you're walking around the block. Or if you're a jogger, they should work when you're doing any activity at all, even getting the clothes out of the dryer. But if they have been burdened and weakened and under the influence of maybe post-surgical or accidents or anything that has accumulated in your life, they're not going to give enough to this whole core, the whole core effort. So when we start having the issues, I work primarily on where are these muscles, how do you access them, how do you make them work better. And it's not something you have to go to Gold's Gyms for. You can do it right as you're sitting, right there. Okay? So that's the quiz. That's the quiz.